Hi, I'm Dr. Birch. So glad you could come today, and I'm so glad to see you on your feet again. That was quite an ordeal you went through. How are you feeling? Are you feeling okay? Okay, that's great to hear. Now, nevertheless, we are going to do a full cranial nerve exam just to make sure that everything is as it should be, okay? And we're starting with the olfactory nerve. Now, the olfactory nerve is the first of the 12 cranial nerves that we have inside our heads. And the olfactory nerve is the one that transmits sensory information about odors into the brain. So it's responsible for our sense of smell. Now, there are different disorders that can be attached to the olfactory nerve, like hyposmia or anosmia, which are respectively reduced sense of smell and a complete lack of a sense of smell. Now, these can occur with peripheral damage to the olfactory nerve, such as rhinitis or simple hay fever, trauma to the face, side effects of certain medications. Now, if you experienced a change in your sense of smell, such that all your food tastes bitter or sour or salty, anything like that, what we would call dysosmia, that could point to a deeper underlying neurological disease, and that's something that we would take very seriously. So those are some of the things that we're testing for today with the olfactory nerve. Now, the olfactory nerve itself is actually quite interesting. It consists of a small area, about 2.5 square centimeters up the apex of each of the nostril, and it's a sort of yellowish brown mucosa that's sitting up there just off the main nasal passage or cavity. And this mucosa is, it's covered by a membrane, and then behind the membrane we have two kinds of nerve receptors. The first receptor is actually trigeminal nerve fibers. The trigeminal cranial nerve is something that we'll come back to later. But that's very sensitive to irritating substances and temperature, not unlike our pain and temperature receptors elsewhere on the body. And of course, the other receptor in the olfactory epithelium is the olfactory nerve, which is the sense of smell. So, are you ready to get started? Great. So the way we're doing this test today is something called the sniff and sticks test. Have you heard of that? Okay. It's a very simple test where I will present you with a number of felt tip pens, which are laced with different smells for different odors, and your job is simply to identify what smell it is. Now, I will present, if you can't just tell just off the cuff, then I'll present you with 4 possible choices. So this is a multiple choice quiz of sorts. Yeah. Now, the test is very, very easy to administer. It's quick, it's painless, and it's also delivering quite consistent and measurable results. So that's why I really like it to test the olfactory nerve. Now, some say it can be a bit subjective and that there are reduced range of odors that we're testing in the sniff and sticks test, but I think for our purposes it's more than enough. And if you do present any abnormalities, we will of course do an extended battery of tests. After the screen test, where you'll identify a number of smells, 12 to be exact, then we could also do the discrimination test, where I present you with 3 different pens and you have to tell which one of the 3 is different from the rest. And there's also the threshold test, where I present pens with a increasing concentration of smell inside them to see where the floor of your sense of smell is, or the threshold. So it's the least amount of molecules that you'll be able to smell. Okay? But we will get to all of that later. First, let's just get the pens and let's get started. Okay? Great. Right here in my little case here. Now, don't be fooled by the color. They are not color-coded, although they may appear to be. So I'm just getting the multiple choice list ready here. There we go. Now, before we do the test, I like to make sure that we have a nice baseline and that your nasal passages are free and clear. So if I could just get you to occlude one nostril, like so, and breathe in very deeply through the nose and out again. Very good. And the other one, in and out. Very good. And now with both nostrils, in through the nose and out. Very good. That sounds very normal, like no blockages or anything, and you don't have a cold or anything like that. Good, good, good. Okay, so then we are ready for the first stick. So just hold it here and okay, so the first of your choices, they are orange, strawberry, blackberry, or pineapple. Orange, that's right. Just note down that. We have the second one here. Need some choices. Okay. You can choose between smoke, leather, glue, or grass. Leather. That's right. Number 3. For this one, you can choose honey, chocolate, vanilla, or cinnamon. That's right, it's cinnamon. Lovely. Now, number 4. Again, the choices here are chives, spruce, peppermint, or onion. That's right, it's peppermint. Now, number 5. And your choices here are coconut, walnut, banana, or cherry. Banana, that's right. Actually, a decent amount of people get that one wrong. Sometimes it can be hard to distinguish different sweetnesses from each other. Well, number 6. You need a break before? Very good. If you need a break or a refresher, just let me know. We have some. We usually use alcohol pads just to clear up the olfactory senses. What do you say for this one? Not quite sure. Okay, so your choices here are peach, apple, lemon, or grapefruit. Grape. It was actually lemon. Yeah. Okay, fine. Okay, number 7. So we're halfway there. For this one, your choices are licorice, wine gum, bubble gum, or cracker. That's right, it's licorice. Oh, what do you say for this one? Your choices here are cigarette, coffee, wine, or candle smoke. It's coffee, yes. Are you a coffee drinker? Okay. The test is specifically designed not to use any irritating substances. I mentioned the existence of trigeminal nerve fibers inside the receptors, the olfactory epithelium, and, well, using any irritating smells like menthol or camphor that could actually activate the trigeminal nerves instead of the olfactory nerves. And we like to keep things like totally separate, so we're just laser focused on the olfactory nerve for this test, and we'll get to the trigeminal nerve later. Yeah. So that was now number 9. Okay, some options: clove, pepper, cinnamon, mustard. No, it's not cinnamon. Try again. You had that one already. Pepper, no. It's actually clove. Try again. Yeah, okay. Well, a lot of people have trouble with that one. Maybe, it's not one of the most common spices to use in the kitchen. Now, number 10, so we have 3 left. Choices here. Pear, prune, peach, or pineapple. Correct. It's pineapple. Now, number 11. Just breathe in deeply. Take all the time you need. Your choices here are chamomile, raspberry, rose, or cherry. Rose. That's right. Now, last one. Choices here are bread, fish, cheese, or ham. That's right. It's fish. Okay, so you did fine that test. A few misses, but there always are. Now, like I mentioned in the beginning, I do want to do the discrimination test as well. So that will involve me holding up 3 pens, and you have to identify which of the one is different from the others. And these smells will be more neutral than what you just smelled. Do you need a refresher? Okay, just try to take a few deep breaths. In through the nose and out through the nose as well. Okay. Okay. You good? Okay, good. Now I'll spread these out in a fan. Okay, which of the ones here is different from the rest? This one, green one. The orange one, or the blue one. Again, the orange. And the green. do a couple of these. Okay. Again, 3 smells or 3 pens, only 2 smells. This is brown. You don't have to identify the smell, it really doesn't matter, just try to focus on which is different. This is red. And pink. Red. And brown. Do you think brown? Okay, try it. One more. So one by one, this is purple. Yellow. And turquoise. Yellow again. Purple. Yellow. Turquoise. Some more yellow. Purple. Okay, one more. Okay, so we first got beige here, the orange tip. Got it. Okay, then we got gray, black, gray, beige, gray, and black. Black. That's right. Okay, very good. Now, I want to move on to the threshold test. And like I said, this is testing the threshold, or the lowest amount of particles that you can smell something. Okay? So your olfactory acuity, you might say. Now, this is the same way as before with a bunch of pens. This time the smell is always going to be the same, and it's going to be a rose smell. You had the rose before, but I just want to present to you the full concentration so that you know what to smell for, okay? Okay, so this is rose, full concentration, okay? This is rose. Okay, so that's what we're going for. And we're starting from the bottom. So, tell me if you can smell something now. Anything at all. Just take your time and breathe deeply. Nothing. Okay. About now. Still nothing. Okay. Nothing. Okay. About now. Anything at all? Maybe you think. Okay. Okay. Like that. Just want to go down again. One you had before. Tell me, can you smell something now? Yes. Okay. Good. No, that's fine. Gonna go one more step down again. The one you had before that. Did you smell anything here? Deep breath in. Nothing. Just take your time. Take your time. Nothing. Okay, that's good. That's great. The threshold is at 6, which is very normal. So that concludes the test of your olfactory nerve. Overall, it was a very common, normal test. You showed no signs of any deficiencies or abnormalities in your olfactory nerve receptors. So, congrats. Now, with that, I'll bid you farewell for now.